implants in the same way that we do with breasts. We can use fat grafting. We can use hybrid buttock augmentation, that is implants and fat grafting, or implants and filler with space. So why are we using derma fillers for buttock augmentation? Why are they popular? A, because the procedure itself is relatively simple. Even if you're not really experienced in injecting the type of products for buttocks, augmentation, asymmetry, to correct concavities in the buttocks, to rejuvenate the hands, and to volumize the calf or treat calf asymmetries. This is highly purified, and there is evidence to suggest that it contains or is free of BDD, and the concentration of BDD in this product is really, really small. Less than important to respect our anatomical landmarks. So the way I do the markings, okay, is I feel for the posterior iliac crest, okay, which is there. Okay, so I mark my posterior iliac crest. Into two halves, the proximal and the distal, and draw a horizontal line across it. Okay, and then I find. So this is the area that we want to inject with a filler. Remember what we discussed, that we want to leave the lower third of the buttock unattached. Entry point we make, we could potentially introduce infection. So we want to do this procedure and offer the result that we want with minimal entry points. Okay, so one entry point can be, doesn't matter where you're coming from. Okay. 1, 2, 3. Okay. You need to inject a lot. Out a few times in different directions, because as you will see, it facilitates the entry of the cannula. In and out, something like in and out, and make the tract. You might bleed a little bit, but don't worry about it. Okay. So, nice trick to go in is squeeze the buttock, squeeze the entry point. Why? Because you want to create a distance between the skin and the buttock muscle. If you do it like that, and you go in, you hit the buttock muscle, and you know, the patient says, "Oh, that's not a good start." Okay, so lift the skin at almost at 90 degrees, and then we change the direction of the cannula at about 45 degrees. Okay. So where do I want to inject? In this area. Therefore, what am I going to do? I'm going to give my local a little bit retrograde. As I come out, I inject a little bit. Yeah, great. Then I move on into a different direction. Are you okay?
Yeah.
It's nice to pinch if it's hard to go in, because fat contains a lot of fibrous septation. So a lot of the times you're going to see resistance. If a patient has undergone M-Sculpt or any energy-based device treatment, they usually tend to. You've had.
I've had.
Yeah, that's why you'll feel it's a bit fibrous. It's fine. It's just that.
Well, because it tightens
it tightens, and it causes inflammation, and then the tissues tend to heal with a little bit of scar formation, so they get a bit more fibrotic subcutaneous tissue, which means sometimes that's sore. Yeah? Sorry. Okay. Still the good plane, inject. And as you can see, I inject little amount of local anesthetic. Okay. Up to 0.5 per area. I don't, use a lot of local to fully anesthetize, because I want her to have a degree of response. If you can't go vertical, try a different direction. Okay, and that's why I want you guys to try. It's quite fibrotic, so you feel the resistance. Okay, so 90 degrees to the skin, pinch, go in for half a centimeter. And then change the direction to 45 degrees and make sure you find the right plane. Okay? There's a lot of crackling here. Can you see that? Okay? I'm not very superficial. If I try to go very superficial, this is very superficial, and you get a bit of, you see the skin starts to bunch. Okay? And you get resistance. This is dermal resistance. This is the dermis telling me, leave me alone. Okay? So, go back. We go deeper. Okay. This is where I want to be.
Yeah.
Okay, this is the outline, and I have quadrants, so I may as well start injecting here in this area, let's say. Okay, and you want to start injecting in different directions, but make sure you don't go beyond your marking. So this is the tip of my cannula. I don't want the cannula to be here and inject in a different area. Okay, so that's why markings are very important. Okay, so I'm there. So I start injecting. If you have a different way, that's absolutely fine. It just makes you feel more comfortable. Can you hear anything?
Yeah, the crackling.
So there's a lot of crackling. You okay?
Yeah.
Yeah, you will feel pushing and pulling, I'm afraid.
Yeah.
You have quite fibrotic tissue, okay, which is fine. That means he's a little bit of a scar tissue from the previous treatments under the skin. That's why it creates a bit more resistance. When I try to go in, I have a bit more resistance, but that's fine. We will overcome this. That's not a problem.
With the adhesions, theoretically, do you think that when you're injecting filler in somebody who is very fibrotic, that it means that they could have pockets of filler, more likely to have pockets of filler, or?
Can do.
Yeah.
Yes, yes. You're more likely to get irregularities. Yeah, and we'll see here, skin and the buttock muscle. And you go 90 degrees initially. Okay, gently, yeah, you're in.
Yep, I'm in.
You're in.
Push.
Then you change into,
Yep.
yeah, you are horizontal. Okay, so what you want, let me just show you. Because you go parallel to the skin, you're more likely to go at the superficial fat compartment. Okay, so let's do it again.
Okay,
you go
keep it flat.
perpendicular in, yeah, you go in. Once you go in, you go 45 degrees.
Okay.
Okay, because then you avoid going close to the skin, and you're targeting the deep fat compartment, which is where you want to use the MLF2 product.
All right.
Okay, now you can you don't have to pinch. Okay, and then your direction is I injected 10 here. Let's inject 10 there.
Here.
So you see where the markings are. You don't want the tip of the cannula to go beyond there.
Okay.
Because that's how you get migration.
Okay.
Because you're in the lower part. You want to stay in this area.
Okay. So I pinch again to make it.
You can do if you want. It helps you.
Yeah, you're very fibrous, Haley.
Yeah.
Jesus.
Right? No, there's nothing. It's just okay. Now
I
very
knew
good.
it, so I
Did you
come
see
out,
that?
yes.
You guys see that?
Yes.
That was superficial.
Yeah. Okay.
So very well. You went back.
Can go back down again.
Okay. Don't pitch. Just have
a
look.
little
You're
bit again.
superficial now. Okay. So go all the way back. All the way back. And
To
start
where?
again.
Okay.
And try without pinching this time.
Okay. Hey, that's better.
Yeah.
Yeah.
Very good.
There.
This is the tip of the cannula.
Yeah.
And you see throughout the tract of the cannula there is no bunching.
Yeah.
Okay, like before. So you're in the right plane. You want to advance a little bit more to reach.
That's as far as it
Yeah.
will go.
Yeah. Okay. Good. Now,
So then I'm just going to
retrograde.
inject.
Now another trick is when you inject. Let me just show you. I'm not going to inject. Try not to inject while the cannula is like that. Okay, because you're more likely to cause irregularities. When you inject, the cannula has to be, you should be able to see it. You do this to see where the cannula is to make sure you're in the right place.